skin treatment with lasers and different machines. Fortunately, we have a lot of lasers and different machines in our office, and our practice offers a variety of treatments. It can be overwhelming and confusing, so I'm going to try to make it simple. We have treatments for skin texture and skin color. We have aggressive treatments and less invasive treatments. If you are starting out and you want to just do something very simple and you say, where do I start? I just don't want something too much. The best thing to do is to see our esthetician for microdermabrasion using a machine called Derma Sweep. That should be your first step. If you don't know where to start there. When you come to see her, she will do the procedure, which does not require any preparation, does not have any downtime. You look like a little pinkish, nice, and go back to work or home. And at that time, she can guide you as to what will be the next step. Then moving forward, we'll keep guiding you as we go along. If you're still unsure what to do, then make an appointment to see me for a facial consultation, and I can guide you at that time. If you want to use this video to help you decide, then here's how you decide. If you have extensive damage to the skin, typically the damage shows in two ways. One is the texture of the skin, where the texture becomes, very rough, big pore size, a lot of fine wrinkles, just age. And the other damage is change in the color, where you have like blotchy skin, meaning like you have some rosacea, some redness, some brown spots mixed together. So the treatment for both is done with two separate lasers. If it's the texture that bothers you, start with Resurfax. Resurfax is a non-ablative, meaning it won't peel off your skin, non-ablative laser with no downtime, just that one evening downtime. That'll help soften the texture. You will need several sessions, but it'll help with the texture. You have to give a month in between, and then you can do another session and another session and another session. If you feel the problem is more to do with the color that is more blotchy, then start with IPL. IPL, Intense Pulse Light. And again, no special preparation, no downtime, and that'll make your color more even in the face. You can then repeat it in a month and keep going on. Both of these are done only during winter months when there's not a lot of sun, or maybe in the fall and spring at times. So those two can be used alternating as well to help you both with texture and with the color changes. So that's the most aggressive treatment that can really make a big difference. Then from that onwards, we can go to the milder ones. Derma Sweep that I already mentioned as a start for patients who have no idea where to start. And then another treatment called Janjua Pen. Janjua Pen softens the skin by tightening it. It's a little electronic device that tiny pokes tiny holes, and then the skin heals with tightening effect. As literally is no downtime except for that evening. You can do that, and then you can alternate that as well with Microdermabrasion, a Derma Sweep as needed. So those are the few procedures that you can figure out on your own just by following these principles. And again, if you're not sure, you make an appointment to come discuss in person. There are a few other treatments called the Thermi treatments, Thermi Smooth and Thermi 250. Those are for wrinkles specific in certain areas. For example, around the eyes and around the lips. If those are the two areas around the eyes and around the lips where you're concerned, Thermi Smooth will smooth that area. It is not miraculous, but it definitely softens it. So that would be Thermi Smooth. Thermi 250 is separate, but that's for the body. So that you don't need to worry. I'm just talking about these lasers. Now, some people are concerned about the brown spots, and they say, listen, I only want the brown spot treatment. What should I do? That's IPL. You come in, we do the IPL, and we improve the brown spots. If somebody says, I just have rosacea, what do I do? You use the IPL for rosacea. It'll get better. You might have some very fine spider veins around the nose or the cheeks or even on the legs, tiny veins. For that, we use YAG. YAG goes individually after each blood vessel to clog it up. So that would be a YAG laser treatment. As you can see, there's a lot of options, and that can be confusing, but if you listen to everything that we have mentioned here, that will help you decide where to start. And again, you're always welcome to call us, schedule an appointment to discuss in person. Otherwise, make your choice and come on over. Thank you. Thank you for watching the video. I hope you liked it. I love doing these videos and I really enjoy the participation and the comments and everything from everyone, and I will keep putting in more material. And if you like it, please subscribe to our YouTube channel so you can keep watching the new editions as they come along. And also, we are active on social media, so please like us on Facebook and on Instagram, and follow us on Twitter. We will try to provide excellent stuff and keep you all engaged and exciting. Thank you very much for your time, and enjoy.